Pharmacologically, after half hour to 1 hour of ingestion, benzodiazepines start being absorbed. Their lipid solubility determines distribution, onset, termination of action. It is not the half life that determines all of that. They're deposited in adipose tissue, and you may want to consider a differential diagnosis of thyroid dysfunction, caffeineism, and prescription medication, recommended to start slowly and taper. The short-acting benzodiazepine half-life is 2 to 4 hours, long-acting 2 to 4 days, and intermediate acting is 1 to 2 days roughly. Short acting benzodiazepine with a half life of 2 to 4 hours. Withdrawal is common, and short half life causes rebound insomnia and anterograde amnesia. The non benzodiazepine anxiolytic drugs, known as Z drugs, act on alpha 1 subunit of the GABA A receptor and cause selective sedative effect. They lack muscle relaxation and anticonvulsant effects, and they're not to be used more than 7 to 10 consecutive days. They have little tolerance or rebound effects. The names of the Z drugs are ezopiclone, zolpidem, zoliplam. The other short-acting benzodiazepines are quazepam, triazolam, midazolam. Of note is another non-benzodiazepine called Buspar. Buspar combines with 5-HT1A agonist receptors and is a partial agonist of selective serotonin reuptake inhibitors. Its onset may take up to 2 weeks, and it is not for acute anxiety. It has active metabolites, it is non-sedating, causes no CNS depression, and no muscle relaxation. It has no additive effect combined with alcohol, causes no dependence, no tolerance. It is good for agitation in demented and brain injury patients. Short half life medications are not given in chronic anxiety. Long acting medication, their first pass hepatic metabolism increases their duration of action. So, what is first pass hepatic metabolism? It is during the metabolism of the benzodiazepines, liver produces active metabolites. Those are absorbed into the circulation and produce benzodiazepine actions once again. Long acting benzodiazepines half life can roughly be 2 to 4 days and longer for hepatic failure patients. Their steady plasma levels can take up to 2 weeks. Therefore, signs and symptoms of toxicity may appear within 7 to 10 days. To remember the names of the long-acting benzodiazepines, I have a story I want to share that may help you recall their names. So the story goes something like this. Tim wants to clone himself, so he goes to his closet and drinks chlorine. He gets flu-like symptoms and dies. To review that, Tim for temazepam wants to clone for clonazepam himself, so he goes to his closet for clozapate and drinks chlorine for chlordiazepoxide and gets flu-like symptoms for flurazepam and dies for diazepam. For intermediate acting benzodiazepine, their half-life can be 1 to 2 days approximately, and the mnemonic here is ALO, A. alprazolam, L. lorazepam, O. oxazepam, E. estazolam. Intermediate acting medications can sometimes go in the short acting and sometimes in the long acting category.